Pittsburgh Sunday Morning. My name's Sean McDowell. If you'd like to be a guest on the program, if you're a member of a group or organization that has an upcoming cause or event that the listening community would be interested in, doesn't necessarily have to be a local cause or event, and it doesn't have to be a nonprofit cause or event either. Contact me. My name again is Sean McDowell. Email me. My email address is my first name. Sean is spelled S-E-A-N. My email address is sean@dve.com. I'll get back to you as quickly as I can. Welcoming to Pittsburgh Sunday Morning for the first time from Compassionate Certification Centers, it's the co-founder and CEO. It's Dr. Bryan Doner. Hey, Dr. Bryan, how are you?
Doing great, Sean. How about yourself?
I'm fine, and we're going to talk all about what Compassionate Certification Centers are all about this morning. CompassionateCertificationCenters.com. Everything's spelled out. 1-888-316-9085. They provide professional private evaluations for patients seeking to legally obtain a Pennsylvania medical marijuana card. Compassionate Certification Centers, CCC. They are a physician-owned company. They're here in Pennsylvania. They're comprised of medical marijuana doctors who are dedicated to helping patients who need medical cannabis. Their mission is to raise the level of treatment that patients receive while seeking their medical marijuana cards by providing trust, clarity, and diagnostic help to help them, the patients, find the right medicine. CCC, Compassionate Certification Centers, they're here to provide you with the support, care, and guidance you need to get certified in the Pennsylvania Medical Marijuana Program. We're going to talk all about this morning, again, with the co-founder and CEO of Compassionate Certification Centers. Dr. Bryan Doner is here. And, Doctor, I already told Dr. Bryan that a very close friend of mine has already gotten her Pennsylvania medical marijuana patient card, so I am aware of the process involved and what the product is here in PA and what is available. And let me just say off the bat, Dr. Bryan, the product here in PA, the Pennsylvania medical marijuana product, is top quality. It's the best. It's as good as you'll find at any recreational marijuana dispensary out west.
I agree completely, Sean. I think Pennsylvania has done a tremendous job since the inception of the program to where we are today to really fine-tuning that, increasing product availability, different strains, ratios. So I agree with you completely that the products that our patients in Pennsylvania have access to are really of the highest quality, and they've been very effective. And the other thing that's really nice about our program here is we know that all of the products are actually grown in Pennsylvania,
Yep.
in our home. They've processed here, so it's really nothing from outside, which is another tremendous part of the program, I think.
Yeah, I'm glad you brought that up. This is Compassionate Certification Center's co-founder and CEO. It's Dr. Bryan Doner, and these are the folks that will help you legally obtain a Pennsylvania medical marijuana card. And everything, the PA medical marijuana dispensaries, like Dr. Bryan just pointed out, it's all grown and manufactured here in Pennsylvania, and it is as good as anything as they sell out west for recreational purposes, because I have been to recreational marijuana dispensaries out west, and everything that they have in the PA dispensaries here stands up to anything else you can buy anywhere else in the country. CompassionateCertificationCenters.com, 1-888-316-9085. They provide professional, private evaluations for patients seeking to legally obtain a PA medical marijuana card. And our special guest again this morning, it's the CEO and co-founder of Compassionate Certification Centers, Dr. Bryan Doner, who has degrees from Denison University, the University of Massachusetts at Boston, the Lake Erie College of Osteopathic Medicine, residency training in emergency medicine at the St. Vincent Health System in Erie. Dr. Bryan Doner is highly trained in both wound care and hyperbaric medicine. He's board certified in emergency medicine. He is a certified hyperbaric and wound care specialist. Dr. Bryan Doner is a fellow of the American Professional Wound Care Association, and he is the attending emergency physician at Armstrong County Memorial Hospital. And as we mentioned, he's the co-founder and CEO of Compassionate Certification Centers. Dr. Bryan is currently obtaining certification to attest for medical cannabis here in Pennsylvania under the Department of Health. He is an advocate for medical marijuana, and As a clinical researcher, our special guest on the phone with us, Dr. Bryan Doner, is especially interested in future research within the medical cannabis industry. Dr. Bryan is a member of the American Academy of Cannabinoid Medicine, Americas for Safe Access, and the Society of Cannabis Clinicians, Compassionate Certification Centers. Dr. Bryan, you guys have locations all over Pennsylvania, including here in Western PA, Butler, Natrona Heights, North Pittsburgh, downtown Pittsburgh, and Washington, PA.
Yes, that's correct, Sean. We have about 10 different clinics now, brick-and-mortar locations located across the state. I would say largely with a focus on Western Pennsylvania. We're going to be opening up our newest office here in the North Hills just next week as well. So we started off at the beginning with one clinic, and we've expanded since then. We have about 20 physicians that work for us, and up to this point, we've seen approximately 30,000 patients and helped them obtain their certification in Pennsylvania. So it's been very robust since we started.
Beautiful. Again, Compassionate Certification Centers, CCC. They provide professional, private evaluations for patients seeking to legally obtain a PA medical marijuana card. All of their physicians, like co-founder and CEO Dr. Bryan on the phone with us, they're all licensed and in excellent standing with their medical boards. Medical cannabis is not only a medical issue, but a legal one as well. And at Compassionate Certification Centers, they follow medical board guidelines and the Pennsylvania law, so that your approval is legal, ethical, and defensible in court. At CCC, they make the process of obtaining your card as simple as possible. Their team of experts will inform, educate, and guide patients to help them obtain a medical marijuana card to improve their overall quality of life. CompassionateCertificationCenters.com, 1-888-316-9085. This is the CEO and co-founder, Dr. Bryan Doner. Dr. Bryan, I've had renowned criminal defense attorney Patrick Nightingale, co-founder of Cannabis Legal Solutions, on this program before, and I know you guys are pals, and he sent me an email and said, hey, give Dr. Bryan my best. He's a great guy. Dr. Bryan, there are still a lot of legal questions to be addressed when it comes to medical marijuana, and many of the states out west where recreational marijuana is legal, they're running into many of these legal questions. Number one being, as Patrick Nightingale and I talked from Cannabis Legal Solutions, Dr. Bryan, number one, maybe the first of the legal questions is, marijuana in the eyes of the U.S. federal government is still illegal.
Yes, you're absolutely right, Sean. It's hard for us to believe, and Patrick, I'm so glad you brought him up. I think the world of him, and Patrick is really the premier legal expert, in my opinion, about these topics, and especially here in Pennsylvania. So, but yes, the breakdown often comes between the federal and the state laws. Mm-hmm. So all of the programs for medical marijuana now have been officiated on the state level, but when you look at the federal level, it's still considered Schedule I substance.
Yeah.
According to the federal government, that means it has no medical applicability or utility at all, which we can say, I think, with certainty at this point that absolutely is not true. Yeah. But the fortunate thing is the federal government is taking some steps in the right direction. The recent updating of the Farm Bill, essentially legalizing hemp and hemp-derived CBD, is really a step in the right direction, and hopefully descheduling is next on the list, so that can really increase availability to patients across the country.
Yeah, it's still so surprising because it being legal, cannabis, recreationally and medically, in I think 30 states right now, to the federal government, marijuana is still a Schedule I drug, as Dr. Bryan just pointed out. That's being included with heroin and LSD, a Schedule I drug, cannabis. This is a gazillion-dollar industry, the growing, manufacturing, and selling of cannabis products. Hundreds of millions of dollars are being generated by this new cannabis industry, but it is still, in the eyes of the federal government, an illegal substance. But Dr. Bryan Doner, co-founder and CEO of Compassionate Certification Centers, marijuana, cannabis, can help people in so many ways. And as we mentioned earlier, you are an advocate for medical marijuana, and you've done a lot of research in this area.
I have, Sean, and that's really been some of my background as a clinical researcher, and then we're still actively involved in clinical research. And when I started off in the medical cannabis industry, I really did a lot of education myself, and I really was able to learn from the patients. And what I started to see over time were just some absolutely profound results. And in particular, where traditional health care had failed patients in the past, medical cannabis really was stepping up, and it helped across such a wide spectrum of different disease processes and etiologies that over time, when I was able to see with patients firsthand the way this could really help change their life, and it was important for wellness, and it could stop suffering, it really had a profound impact on me. And I can say to you now that in the 10 years I've been a practicing physician, I've seen medical marijuana help more people than arguably anything else, maybe outside of antibiotics. So it's, in my opinion, it's been profound, and it's really changed the way I practice as a physician, too.
Our special guest this morning is Dr. Bryan Doner. He is the CEO and co-founder of Compassionate Certification Centers. They'll help you get your PA medical marijuana patient card. That's what they're all about, making the process of obtaining your card as simple as possible. CompassionateCertificationCenters.com, 1-888-316-9085. Okay, Dr. Bryan, how to get your PA medical marijuana patient card. Step one with Compassionate Certification Centers, schedule an appointment. And we just gave the website out there, CompassionateCertificationCenters.com. You can register online there to schedule your appointment, or you can call 1-888-316-9085 to begin the evaluation process. And again, they have offices, Compassionate Certification Centers, offices all over Western PA here, Butler, Clarion, Erie, Natrona Heights, downtown, and in Washington, PA. Dr. Bryan, what is the evaluation process exactly? Now, and my dear friend, and she gave me all the details, you first have to have proof from your own doctor that you do indeed qualify with one of the 21 necessary conditions here in Pennsylvania, right? That's what you need first.
Yes, that's absolutely correct. And I even started a little bit before that, Sean, is that when you have, assuming you have one of the qualifying diagnoses, it's then also important to be able to find a physician who is registered and qualified to be able to certify the patient for medical marijuana. It's a confusing point for many patients. The overwhelming majority of doctors in Pennsylvania right now are not listed on what's called the physician medical marijuana registry. And in order to do that as a physician, we have to take class and get educated. And then once we're listed on this registry, we are able to provide certifications for patients. So really, I encourage patients to make sure they ask their physicians if they're in a position to do this now, as alternatively, they're going to need to provide or find another physician or another organization that can help them with that. I can speak to you with regard to the process at Compassionate Certification Centers. We've tried to keep this as close to traditional medicine as possible, and that's really to provide patients with a comfort level. So patients are typically going to pick up the phone, and they're going to contact one of our employees. They will walk them through the process with regard to obtaining medical records, helping sign consents, releases. The patient then will have an appointment scheduled. They come into the office just like would be a physician visit with their PCP or anyone else, where at that point we make sure that we have the appropriate documentation. They go through an intake screening process with our nursing staff and our clinical staff, and then they spend some time with the physician where the PA medical marijuana program is explained, the medications are explained in detail, and a treatment plan is outlined. And then beyond that, really it's providing ongoing support for patients as well, because once you get your medical marijuana card, that's only one step of the process. Really, your treatment plan is going to be ongoing, and organizations such as ours are able to provide that ongoing support for patients.
And we're going to go over the 21 qualifying conditions, too, that are necessary to qualify for a Pennsylvania medical marijuana patient card. You need some medical records documenting your qualifying condition, like Dr. Bryan was just talking about. CCC, Compassionate Certification Centers, they'll review your medical records. They'll schedule your evaluation appointment. Same-day appointments are available for patients with qualifying records in their possession. And again, Dr. Bryan Doner, there were 3 steps to get your PA PA medical marijuana patient card through compassionate certification centers. Step 1, schedule an appointment. Register online. Step 2, meet the doctor. So a compassionate certification center doctor will review your records, perform an exam, discuss your condition, history. They'll prescribe the proper use of medical marijuana. They'll answer any questions you have. If you already have a qualifying condition, your CCC doctor can approve it. And again, Dr. Bryan, you do need to have one of the 21 qualifying conditions to enable you to get a PA medical marijuana patient card for all people, as a matter of fact, right?
Yes, that's correct. You need to have one of those 21 qualifying conditions, just like you said. Many times, Sean, certain people, they may have a qualifying condition and not even know it. So obviously things such as cancer or autism or seizures may be very apparent. Yes. But you have qualifying conditions such as chronic pain or neuropathy. I've had so many diabetic patients who didn't realize that their peripheral neuropathy would qualify them. I've had many patients with, say, chronic migraines or different type of chronic pain that fall under that chronic pain category, but yet the patient doesn't know that. So I really encourage everybody to ask, and patients can always pick up the phone, call our toll-free number, and if they don't have if they have questions at all, there's no obligations. Our staff can help answer it for them as well. But it's a really important point that you help clarify.
Yeah, and did everybody just hear what Dr. Bryan Doner just said? He's the CEO and co-founder of Compassionate Certification Centers, and we're going to go over the 21 qualifying conditions. You have to have one of these to qualify for a PA medical marijuana card. But Dr. Bryan just mentioned if you have migraines, my wife has dealt with migraines for the last 30, 40 years. If you're diabetic, the neuropathy that comes along with diabetes at times for certain folks, these are qualifying conditions for a Pennsylvania medical marijuana card. Okay, and let's see, step 3. Once your submitted application has been approved and processed by the Pennsylvania Department of Health, Dr. Bryan, then the Department of Health will send you out your medical marijuana patient ID card. And again, my dear friend, this took her 3 weeks tops. Well, showing up at a certified cannabis doctor here locally, getting the evaluation, getting checked and everything. She is my dear friend is a cancer survivor herself. The application was sent in. She had her PA medical marijuana patient card within 3 weeks. It looks a lot like a Pennsylvania driver's license. Yep,
that's exactly correct. And we can really get the process done quickly. There's been times when patients with potentially terminal illness or really where time is of the essence, where we've been able to get certifications issued within a matter of days. So really the process can be streamlined, and our organization really focuses on helping the patients sort of go through that path and avoid any pitfalls that may be there as well. But I think the other thing that's really important too, Sean, is that patients know that the support that they're going to get is not only with their physician or at the doctor's office, but also at the dispensary. The dispensaries have medical professionals, pharmacists there, so that patients actually have support on site there as well. And that's a really key thing in order to make sure that these treatment plans are as effective as possible.
Yeah, and I just wanted to also point out, Dr. Bryan, thank you so much for joining us this morning, that a lot of folks maybe still, remember, and Dr. Bryan Doner, by the way, he's a Pittsburgh guy, so being a Pennsylvania guy, as all of us in Pittsburgh are, we were all so excited when we were finally able to buy 6 packs of beer in convenience stores. So that Pennsylvania has now legalized medical marijuana. This is huge, and you're not dealing with people with long hair and earrings. They're not Cheech and Chong. These are doctors. And the dispensaries, like Dr. Bryan just pointed out, I'm not allowed in one, actually, because I don't have a Pennsylvania medical marijuana patient card, but my dear friend does. And the people, she tells me, when she goes into the local dispensaries around Pittsburgh here, they are as professional as you can imagine. As Dr. Bryan just pointed out, you're not dealing with Cheech and Chong again. This is life-saving stuff we're talking about. It's life-changing medicine. Cannabis. I mean, forget about the preconceived notions of hippies sitting around smoking bongs from the 1970s. This is medical marijuana, cannabis, and it works for so many different conditions. Right, Dr. Bryan?
Absolutely it does, and it's really shown. This is based on science, and it's based off definitive science that we know of. You know, really, cannabis has been used medicinally for over 1,000 years, and really there wasn't a change until particularly in our country, until the late 1800s, early 1900s. But when you look at the science, every human and every mammal, in fact, has what's called an endocannabinoid system. So we actually make some of these chemicals on our own in our body, and they're critical for physiological function. So the plant cannabinoids are really just structural analogs of these. So just like we're able to augment other biochemical systems in the body, we're able to use cannabis and do the same thing. And there really truly is science behind this. And I'm so glad you brought up the point that this isn't a Cheech and Chong type of thing. The people that are coming to see us really this gives them hope, and it helps prevent and end suffering. So it's really been profound what we've seen from that end. And honestly, it's minimal of our patients who come in and are really looking for this from a recreational standpoint. Most people really medicinally are looking for something to try to help them feel better and overall wellness in their life.
Yes, and I mentioned that I have been to a couple different recreational marijuana dispensaries out west, and the same product that they have out west for recreational purposes, it's the same product that they sell here in the Pennsylvania medical marijuana dispensaries. It's top quality. It's as good as you'll find anywhere in the country, from dry bud to liquid cartridges, everything you need, and it's reasonably priced too. And I have to say now, it's not through the roof expensive. It's not cheap, but it's absolutely affordable, and it's top quality again. And every marijuana, THC, cannabis product sold in a Pennsylvania medical marijuana dispensary, as Dr. Bryan Doner pointed out, everything is grown and or manufactured right here in Pennsylvania. CompassionateCertificationCenters.com. We have the CEO and founder of Compassionate Certification Centers on the phone with us, Dr. Bryan Doner. We're talking about how to get your Pennsylvania medical marijuana patient card, 1-888-316-9085. Okay, Dr. Bryan, the 21 medical conditions that are approved by the state of PA to qualify someone for a medical marijuana patient card. You have to be diagnosed with one of these conditions in order to qualify for a PA medical marijuana certification. I have the list in front of me, Dr. Bryan. We could use your expertise moving forward here. Starting off with addiction substitute therapy. So if you're trying to break a drug addiction, medical marijuana, cannabis can help?
Yes, and this is specifically, Sean, with regard to opiate addiction substitution therapy. And this really piggybacks off of what you had said about I think the Commonwealth has been conservative when it comes for change. But with our medical marijuana program, we have been so progressive. And Pennsylvania was actually one of the first, if not the first state, to put opiate addiction substitution therapy as a qualifying condition on its own. And really what this means is that patients are able to use medical cannabis as a tool to help eliminate their dependence on opiates. And it works fantastic for a few reasons, in my opinion. Many patients on opiates now are do so because of chronic pain, right? Medical cannabis can actually take the place of that, where you're not going to need opiates to treat your pain any further. I think beyond that as well, the other thing that's super important is that medical cannabis can help decrease the symptoms of opiate-related withdrawal. So the anxiety, the diarrhea, the racing heart, the anxiety. Really, cannabis can help treat those symptoms as well, so it can make a successful wean from opiates much more practical and possible.
We're going over the 21 medical conditions that are approved by the state of Pennsylvania to qualify someone for a medical marijuana patient card. The first medical condition we just discussed, addiction substitute therapy, ALS or Lou Gehrig's disease, autism, cancer. My dear friend who qualified herself for a Pennsylvania medical marijuana patient card, she is a cancer survivor. Dyskinetic and spastic movement disorders. What are we talking about here, Dr. Bryan?
This could be something such as, say, Tourette syndrome or abnormal muscle spasm disorders, really sort of dyskinetic or abnormal movement-related disorders.
Crohn's disease. Everybody has heard of the digestive disorder, Crohn's disease. Damage to the nervous system of the CNS. What is this, Dr. Bryan?
So what this is basically that the CNS stands for your central nervous system.
Okay.
And really what you're talking about here is damage to the brain and or spinal cord that's causing abnormal neural or neuron-related communication.
Okay, we're talking about the 21 medical conditions that are approved by the state of PA to qualify you for a medical marijuana patient card. Lou Gehrig's disease, ALS, we mentioned addiction substitute therapy, autism, cancer, dyskinetic spastic movement disorders, Crohn's disease, damage to the nervous tissue of the central nervous system, epilepsy, glaucoma, HIV, AIDS, Huntington's disease, inflammatory bowel syndrome. Dr. Bryan, intractable seizures, what are we talking about here?
Sure. So, there's a little bit of some overlay, Sean, when you look at these. So, for example, intractable seizures and epilepsy can essentially be continued as one. So really what you're talking about is an ongoing seizure-related disorder, right? So these could be generalized seizures, what we call absence seizures, but any ongoing chronic epileptic or seizure-related disorder would qualify.
I do the MS walk every year, Dr. Bryan. Multiple sclerosis is one of the 21 qualifying conditions here in Pennsylvania for a medical marijuana patient card. MS, my wife's sister, Lori, has MS, and she is also a patient. And now Massachusetts, I'm pretty sure Massachusetts just legalized recreational marijuana, but she has been able to obtain medical marijuana from either Massachusetts or Rhode Island. I forget which, but my sister-in-law is an MS sufferer. Neurodegenerative diseases, such as, Dr. Bryan?
Sure. You might think about something neurodegenerative such as Alzheimer's disease or Parkinson's. Right?
Yes,
absolutely.
Well, you just mentioned Parkinson's. Parkinson's disease is one of the 21 qualifying conditions here in PA. PTSD, post-traumatic stress disorder, severe chronic or intractable pain. I think we touched on this already, Dr. Bryan. There's a lot of folks. What if you got into a car accident 10 years ago? Your body never fully recovered. What if you're a veteran? You were wounded in action in Afghanistan or Iraq. Chronic or intractable pain, that is a qualifying condition for a PA medical marijuana patient card.
Absolutely. And to be honest, Sean, that's probably the most common qualifying condition that we see in our patients. And it's really important that people understand what would qualify as a chronic pain diagnosis. So you need really two components of this. First, you need something that would cause chronic pain, whether this is migraines, a history of a knee replacement, back surgery, take your pick. There's many things. And then to be chronic in nature, it needs to be present for greater than 3 months. So when you look at most patients who have some type of pain-related disorder, they really would fit into this category as well. So that's why I always encourage patients to understand how their particular diagnosis may fit in with the medical cannabis. So and chronic pain is the perfect example.
Yes, and along with chronic pain, sickle cell anemia and those who are terminally ill. We just discussed the 21 medical conditions that will qualify someone for a Pennsylvania medical marijuana patient card. And all of these 21 qualifying conditions, they're listed and explained on the website CompassionateCertificationCenters.com. And you must have medical proof from your personal doctor that you do have one of these conditions. You need to bring that paperwork with you to a Compassionate Certification Center location to get the process up and running to get your Pennsylvania medical marijuana patient card. And again, CCC, Compassionate Certification Centers, they are a physician-owned company here in PA. They are comprised of medical marijuana doctors. These aren't people standing there with long hair, with goofy grins on their faces. These are doctors who are dedicated to helping patients who need medical cannabis. And their mission is to raise the level of treatment patients receive while seeking their medical marijuana cards. They provide trust, clarity, and diagnostic help to all the patients, helping them to find the right medicine. Compassionate Certification Centers, they're here to provide you with the support, care, and guidance you need to get certified in the PA medical marijuana program. Dr. Bryan Doner is our special guest. He's co-founder and CEO of Compassionate Certification Centers. We're just about out of time. Dr. Bryan, right off of your website, CompassionateCertificationCenters.com, right off of the frequently asked questions, the FAQ section, how much does the whole process cost, not including the cost of the product itself? My dear friend, I think she said she spent total to get the ball rolling, not including the cost of the product, $250? roughly?
I think that sounds exactly right, Sean. So typically what you're talking about, because it's federally illegal, unfortunately, insurance does not pay for this now. But usually you're talking about for an actual certification appointment, typically the charge is anywhere between $150 to $200 or so. And then there's a state-regulated fee that's $50. Basically, it's a processing fee in order for the Department of Health to send the patient their medical marijuana certification card.
Right.
Now, most certifications are done for an entire year, so that cost basically is for an entire year, and then the actual product at the dispensary carries with it cost as well. But those costs have been decreasing since we've had more grows and more dispensaries come online. The product availability and the cost, the price point has really gone down as well.
Dr. Bryan Doner, co-founder and CEO of Compassionate Certification Centers, and all of these tremendous frequently asked questions are listed on the website. Unfortunately, we're out of time. Questions like, will my health care insurance cover the cost of my cannabis evaluation, the follow-up, any other costs? Let's see, we talked about our pal, our mutual friend, criminal defense attorney and co-founder of Cannabis Legal Solutions, Patrick Nightingale. And we talked about this with Patrick, Dr. Bryan. Can I get my PA medical marijuana patient card and still own a gun? Can I lose my job in Pennsylvania for having a PA medical marijuana patient card? Can I be restricted in the workplace because of my PA medical marijuana patient card? All of these questions are answered on the website, CompassionateCertificationCenters.com, 1-888-316-9085. All of their physicians, like co-founder and CEO, our special guest this morning, Dr. Bryan Doner, all of their doctors are licensed and in excellent standing with their medical boards. They have offices all over Western PA, Butler, Natrona Heights, North Pittsburgh, downtown, and Washington, PA. Again, their mission is to raise the level of treatment patients receive while they're seeking their medical marijuana cards here in Pennsylvania. Compassionate Certification Centers, they provide trust, clarity, and diagnostic help to get their patients to find the right medicine. They provide professional, private evaluations for everyone seeking to legally obtain a Pennsylvania medical marijuana card. Thank you so much, Dr. Bryan Doner. It's been great to talk to you, sir.
Thanks so much, Sean. I really appreciate the opportunity.
CompassionateCertificationCenters.com, 1-888-316-9085. This has been Pittsburgh Sunday Morning. My name's Sean McDowell.